expected finding in what? Cardiovascular expected finding in the patient who is pregnant. This is antepartum question. Which statement indicate understanding? My blood pressure will rise steadily throughout. That means your blood pressure keep on going up. My heart rate will increase by 10 to what? 15. That's what they're saying. Their blood volume will decrease. And then their cardiac output will remain the same before as pregnancy. What do you think? There's a concept here, and I want you to get it. This is very key. Antepartum questions you may see. Which answer choice would you pick? Which answer choice? What do you think? Let me know in the comment section. But your heart rate is going to increase, right? Your blood volume is also going to increase. Your cardiac output is going to increase. Therefore, my cardiac output remain the same as before. It's wrong answer. I should expect my blood volume to decrease. Is the wrong answer. My blood pressure is not going to increase steadily. That's preeclampsia. Therefore, this is the right answer. Okay, so this is the key I want you to pay attention. This is how much it goes up, and that's the associated symptoms. And then it's teaching about cervical cancer screening and promotion, right? Which statement by the client indicate correct understanding? What do you know about cervical cancer? Know this. I'll begin Pap smear at what age? 21, regardless whether you have sexual intercourse or not. If I had HPV vaccine, I don't need Pap smear. Is that okay? Pap smear are done after what? 30 years. Is that right? If I'm not sexually active, I will not need Pap smear. What would you choose? This is health promotion. I know you got it. I can tell you the right answer is not D. Why? Because whether you have sex or not, you're going to have Pap smear. Your sexual activity increases you having what? Cervical cancer, and we do it more frequent on you. Not frequent, but mostly we screen you, right? And therefore, this is wrong. Pap smear does not start 30. It's too old. And if you have vaccine, you still need Pap smear. Therefore, just by elimination, this is your right answer. And this is key. We do it regardless of sexual intercourse. What should the nurse do first? Prioritization. The client is in active labor, stage of labor. That is what the patient is. And you're requesting opioid, active stage of labor. Probably they're going to go transition phase and they're requiring pain medication. What would you do? Give it to them for comfort, check the baby heart rate, a mommy contraction, put the mommy client into a deliberate position and offer spinal anesthesia instead. Which one would you pick? I can tell you 2 is the right answer. Why? Active phase, opiate is going to cause respiratory depression. It's going to slow things down. Labor is going to prolong. We should not do that. So don't give it for comfort just because they need it. Placing the client to a deliberate position, it means you still want to give it to them without not doing assessment. Assess before opiate. Spinal anesthesia, they ask for opiate. You don't want to give them standardized anesthesia. That's not what they ask for. What instruction is best? That means which one is best? The client is in 3rd trimester, reports shortness of breath when doing what? Laying flat. What would you tell them? This is expected in pregnancy. Try using pillows when resting. You may be developing preeclampsia. These indicate preterm labor. You should restrict fluid at bedtime. 3rd trimester, mommy stomach is big. The belly, she's too gravid, right? And this is their chest. The diaphragm is being pushed by the uterus. If you lay flat, it's a bad problem. That's why we tell you not to lay flat. Therefore, which answer choice you think is appropriate? This is an expected finding. 2, there's no indication of preeclampsia. It has nothing to do with shortness of breath. You need to have what? Neurological changes. You need to have kidney problem. You need to have your blood pressure to go up. It does not indicate preterm labor. There's no contraction there. Restricting fluid will not help with the shortness of breath. That's all. Which nurse recommendation is most appropriate? 9 weeks reporting nausea. How do you treat it? I pick most antepartum questions because they are friendly They are gentle, but you got to be comfortable answering them. Nausea, morning sickness, well, eat 3 large meals. Drink fluid with milk to promote digestion. Eat crackers before getting out of bed. Avoid protein in the morning. There's so many remedies for this, but there's one for exams that you're supposed to know. Small frequent meal at a time. Things that will prevent nausea. Which answer choice would you pick? Let me know. Let me know your strategy for reporting or for treating morning nausea clinically. Let me know. You can put it down. Next time I'll take a look at it and put it in the notes. Key concept, how morning sickness help, what kind of treatment you have. What do you think? But I can tell you small frequent meal at a time. So this is the right answer, number 3. Therefore, 1 is wrong because it's a 3 large meal. You want small frequent meal. Drink fluid with milk to promote digestion. That's more likely to cause nausea. You should not avoid protein. What is this testing? Once again, antepartum questions. There is a reason why I picked them because they are key counseling questions. Which should the nurse recommend? A 28 weeks pregnant lady asking about vaccine. Before you answer the pick an answer choice, tell yourself, pregnant lady is immunocompromised. I should not give them any live vaccine. Next thing you ask yourself, which one is a live vaccine? That's all. That's how you answer the question. So in my head, I said, what? I have 28 weeks. I need vaccine. And I write it down. I said, I don't need any live vaccine. And I look at the answer choice. I said, which one is a live vaccine? Tdap, is he a live vaccine? MMR, is he a live vaccine? Varicella, is he a live vaccine? Influenza, inactivated, is he a live vaccine? HPV. What do you think? Think about the answer. And let's break it down. We all know MMR is a live vaccine. Varicella is also a live vaccine, in addition to HPV. The oral form, in the activated form, influenza is a live vaccine. This one said inactivated. This is what we got all the time. The nasal one, we get into trouble with. Therefore, this one and that one is acceptable for this particular patient because they need non-live vaccine. Next, administer magnesium sulfate, which finding require immediate intervention. What does magnesium going to do? Respiratory rate 10, reflex is absent, urine output 50, serum magnesium of 7.5, client report flushing, and 1. Temperature. Which answer choice you want to pick? Before you answer choice, pick this. Tell yourself, select and apply. If I know 2, I'm picking 2. If I know 3, I'm picking. I'm not picking all 5 if I don't know it. Then you go back. You say, what is magnesium? It's going to drop everything. If I give you magnesium, I'm increasing your concentration of magnesium. That means things are going to go down. Therefore, how low do you want it to go? Respiratory rate of 10. It has gone too low. If you go below 12, we have a problem. If you don't have reflexes, we have a problem. Your urine output, if it's go down less than 25, this is up. If your magnesium is too high, we have a problem. And you are flushing and warm, that's the expected finding. Therefore, which one are we worried about? What do you think, guys? Which one are we worried about? Respiratory rate of this is too low, reflex is going down, and your serum magnesium is too high. Those are bad stuff. And I want you to take a look at the explanation. And that's what I've explained to you. Too high the level and the respiratory are going down too much and you have no reflexes. Now, nurse is caring for a client immediately after amniotomy. Which intervention are indicated? Select and apply. Assess the fetal heart rate, monitor for cord prolapse, place the client supine with the leg flat, observe the color and the odor of the amniotic fluid, and delay vaginal exams until 12 hours later. Stop your video and let me know what you think. Let me know which answer choice is appropriate. But if you do amniotomy, right, fluid leaks, what is going to follow? Placenta is going to follow. You have cord prolapse. Therefore, I'm going to monitor for it. If I have cord prolapse, the baby heart rate is going to change. Mommy is not supposed to be in the supine. That is bad. Need to chest is better. I need to see what fluid come out and whether there is signs of meconium infection. Check. And you need to continue to assess the vagina to make sure there's no cord prolapse. Waiting for 12 hours is not a good idea. And you can see how the answer choice is clear and precise, and it popping out like a candy. If you break it down that way, you can answer any questions the NCLEX will give you. All the information is in the question. Bring your content with it. Now, don't run away. This it may be intimidating, but you know it. It's just a picture. What is the most common complaints the caring nurse should anticipate for a client in labor position with that? This is the fetal position. The question is complain. Underline the word complain. Stick with complain. That means what is the mommy going to report about? Then you look at the question and you say, what is the problem? This is the fetal monitor sign picture that we've seen from the baby situation where it's located. When you see it, your right side is mommy left and your left side is mommy right. This is the baby. The baby is facing what? Face is towards anterior, by the back of the head. That's the occipitus. Is the most important. Is touching the back on the right side of the mother. So we have right occipital posterior. What are the signs and symptoms mommy is going to show? Whenever they contract, are you going to have pressure in the pelvic? You're going to have back pain. You're going to have abdominal pain with contraction, or you have dark vaginal bleeding. There's not going to be dark vaginal bleeding. That's no placenta obstruction. Baby is going to push on the back of the mother. It's going to cause pain. So the right answer is back pain. Pelvic pressure is indistinguishable from that. And the abdominal pain is irrelevant. And therefore, that's the right answer. And I've given you the answer for this. This is the same thing. What is the baby position? It's right occipital posterior. If it's here, it will be left occipital posterior. If the baby back is facing the anterior, it will be right anterior, occipital anterior, whether it's on the right side, on the left side. If you need more how to name this, check a Dublin case for content like that. So this is right occipital posterior for this patient. Fetal monitoring. Is it a problem for you? It may be. But if you need more help, check out Dr. Class. We have a bunch of maternity videos on fetal monitoring that can help you. What do you think? What is the first action? What are you going to do? The nurse observe a client in labor, and this is what we find. This is what we find. What are we going to do? Right? Reposition the client to the left side. Administer oxygen. Reposition the client in the knee to chest position. Infuse isotonic solution. Before you answer the thing, look at the diagram again. And I can tell you, fetal monitoring, always really like that. This is the mother, and this is the baby. The contraction here represents mommy. If it's less than 5 or 5, that's good. We have 3, this is good. What is happening to the baby when the mommy contract? Look at how mommy contract. What is happening? When the mommy contract, you draw from here. Nothing is happening. But then when the mommy is at the peak, baby heart rate drop. But here, mommy is not contracting. Baby heart rate drop anyway. Mommy start contract. Baby heart rate drop in the middle. Mommy is not contract. Baby drop. This is what we call variation between contraction and the fetal heart monitoring. There is variable deceleration. Then you write your VH of mine and you said variable deceleration. What does it lead to? It does not lead to what? Placing the client in the left lateral position. That is placenta insufficiency. This is called prolapse symptoms. Giving them oxygen is okay, but the best answer is knee to chest position. So this is the way you think about it. You can give them fluid, you do your lie-on, but patient is in what? Having variable deceleration position first before fluid. So that's what you do. And that's the way I will explain it to you.